Take a moment right now and just notice your belly. Not dramatically, just notice. Is there a low-grade pressure that has quietly become your normal, a heaviness that sits there through most of the day, that you have learned to work around, to ignore, to accept as just the way things are now? Maybe you have been straining more than you used to. Maybe the bathroom no longer feels complete. Maybe the bloating arrives without warning and stays longer than it should. If you are over 60 and any of that sounds familiar, I want you to know something before we go any further. This is not simply what aging feels like, and it is not your fault. What is happening inside your gut right now has a very specific biological explanation, one that is directly connected to changes that occur after 60 in ways that most general advice simply does not account for. I have spent the last 15 days going through the peer-reviewed research on gut health and constipation, specifically in adults your age, and what I found is not complicated, but it is almost never explained completely. By the end of this video, you will understand exactly what is happening inside your body, why the standard advice has only been giving you partial answers, and you will have a natural 5-step protocol you can begin tonight. That costs under $4 a month, and is built on the kind of lasting restoration your body is still absolutely capable of. Now, before anything else, I want to acknowledge something. You have probably already tried the basics: more fiber, more water, maybe a laxative here and there, and perhaps things improved slightly for a while, but never quite the way you hoped, never lasting. That experience is more common than you might think. Harvard Medical School data shows that approximately 1/3 of adults over the age of 60 report at least occasional constipation, making it one of the most widespread and least adequately addressed gut conditions in this age group. And the reason most advice falls short is not because fiber and water are wrong. It is because they are incomplete, for adults over 60 specifically. There are 2 additional pieces that almost never get mentioned in a standard appointment. The first is something called pelvic floor dyssynergia, and I will explain exactly what that means in plain language in just a moment. But the short version is this. In many older adults, the muscles responsible for the final act of elimination are not relaxing the way they should, and no amount of psyllium husk can fix a mechanical coordination problem. The second piece is medication. Harvard Health Publishing specifically flags this as one of the most overlooked drivers of constipation in seniors, because antidepressants, calcium channel blockers, iron supplements, and certain blood pressure medications all slow gut motility or pull water from the stool, quietly working against everything else you are trying to do. Neither of these gets addressed in a 2-minute conversation about eating more vegetables. That is not a failure of your doctor. It is simply the reality of a 15-minute appointment that cannot cover everything, and that is exactly the gap this video is here to fill. Now, I am going to walk you through the biology of what is actually happening. But before I do, I want to flag something about step 3 specifically. It involves a simple position change, something you can do starting tomorrow morning with no equipment and no cost, and it directly addresses the mechanical piece that fiber alone cannot reach. In a clinical trial of older adults with chronic constipation, psyllium fiber reduced total gut transit time from 53.9 hours down to 30 hours. A genuinely significant improvement, but pelvic floor dyssynergia, the exit door problem, remained unchanged. Step 3 is what addresses that, and I do not want you to miss it. But first, drop your age and the city you are watching from in the comments right now. We read every single one. You are part of a community of adults who are done accepting incomplete answers. So let me show you what is actually happening inside your gut after 60, because once you understand this, the protocol at the end will make complete sense. Think of your colon as a long conveyor belt, one that moves everything along through a series of coordinated muscular contractions, and eventually delivers it to an exit door that needs to open at exactly the right moment. After 60, 2 things change in that system. The conveyor slows down, and the exit door becomes harder to open. Here is the biology behind both. Running throughout the wall of your colon is a network of specialized pacemaker cells called interstitial cells of Kagel. Think of them as the gut pacemaker, the electrical system that initiates and coordinates the rhythmic contractions that move stool forward. Research published in PMC confirms that the density of these cells decreases measurably with age. which means the timing and strength of those contractions becomes less reliable. Alongside that, the high-amplitude propagating contractions that propel stool through the colon, the powerful waves that create the urge to go, become less frequent after 60. What was once a reliable, well-timed system begins operating on a slower, less predictable schedule. And running beneath that is a layer of biological signaling that most people never hear about. When your gut bacteria ferment dietary fiber, they produce short-chain fatty acids, acetate, propionate, and butyrate. These are not just byproducts, they are active signals, binding to receptors on the colon wall called GPR41 and GPR43, directly stimulating motility, mucosal blood flow, and the fluid secretion that keeps stool soft and movable. Think of SCFAs as the butyrate signal, the internal communication system that tells your colon it is time to move. But after 60, age-related changes in gut microbiota reduce the diversity and abundance of the bacteria that produce these compounds. Less butyrate signal, slower, drier transit. Now, the exit door. At the end of the conveyor belt sits a coordinated set of pelvic floor muscles, including one called the pubortalis, that must relax in a very specific sequence to allow normal defecation. In many older adults, this coordination becomes disrupted. Instead of relaxing, these muscles paradoxically contract at the moment of attempted defecation. The exit door tightens instead of opening. This is called pelvic floor dyssynergia, and in plain language, it means your body is working against itself at the exact moment it should be working with you. This is why the Canadian Family Physician Journal, in a 2015 clinical review, specifically identified pelvic floor dysfunction as fiber-resistant. You can optimize everything upstream and still find yourself straining at a door that will not open. And underneath all of this, medications. Opioid pain medications, certain antidepressants, calcium channel blockers used for blood pressure, anticholinergic drugs, all interfere with the neurotransmitter signals in the enteric nervous system that drive motility. Specifically, they inhibit acetylcholine release, the primary promotility signal in the gut wall. They also alter the epithelial transport channels in the colon, pulling more water out of the stool than normal. The result is stool that moves too slowly and arrives too dry. The conveyor is slow, the butyrate signal is quiet, the exit door is stiff, and the medications are pulling the moisture out of everything in transit. That is the complete picture. And here is the encouraging part. Every one of these changes, the slower movement, the quieter butyrate signal, the reduced microbial diversity, and even some of the mechanical problems, can often be supported through simple daily habits. In other words, when you restore your gut health, you are not just helping yourself have better bowel movements. You are helping restore the biological environment your digestive system depends on every single day. And now, let me show you the 5-step gut health restoration protocol's success through a real-life case study. Margaret is 68 years old, retired schoolteacher, methodical, patient, the kind of person who follows instructions carefully and does not give up easily. For 2 years, she did everything she was told. High-fiber cereal every morning, 8 glasses of water a day, a fiber supplement before bed. Results were inconsistent at best and never lasting. Her daughter, a registered nurse, sat down with her one evening after Margaret mentioned that the straining had started affecting her sleep and her confidence about leaving the house. Her daughter asked her 2 questions: whether she had ever tried changing her position on the toilet, and whether anyone had reviewed her blood pressure medication in the context of her gut symptoms. The answer to both was no. Margaret was skeptical, quietly, the way someone who has already tried everything sensible tends to be. She told her daughter it seemed too simple. 4 weeks into this protocol, Margaret walked the full block around her neighborhood for the first time in over a year, without stopping halfway because of bloating or urgency pulling her back inside. At her next routine checkup, her physician reviewed her progress and noted, without prompting, that her symptoms had clearly improved. No new prescription, no referral, just a quiet acknowledgement that something had changed. Margaret's daughter smiled and said, "The biology is complicated, the fix does not have to be." This is called the Gut Health Restoration Protocol. 5 steps, all of them natural, all of them starting from your kitchen or your bathroom. Total cost, under $4 a month. Step 1, the cilium window. Every evening, Mix 1 level teaspoon of plain psyllium husk powder, approximately 5 grams, into a full glass of water or warm herbal tea. Drink it immediately before it thickens, and follow it with a second glass of plain water. Psyllium is a soluble, gel-forming fiber that does something most food fibers cannot. It absorbs water and forms a soft, bulky gel in your colon, increasing stool hydration and volume, while simultaneously feeding the bacteria that produce the butyrate signal. In a meta-analysis published in 2022, reviewing 16 randomized controlled trials involving 1,251 participants, 66% of those in fiber groups responded positively compared to 41% in control groups. Stool frequency increased and consistency improved, with the strongest results at doses above 10 grams per day for at least 4 weeks. Start with 1 teaspoon. Give your gut 2 weeks to adjust before increasing. 2 critical rules. Take it at least 2 hours away from any medications, because psyllium can slow the absorption of drugs taken at the same time, and never take it without adequate fluid. In a senior with reduced gut motility, dry psyllium can worsen blockage rather than relieve it. Cost under $3 a month for a generic store-brand bag. Step 2, the warm water wake-up. Before anything else tomorrow morning, before coffee, before breakfast, before checking your phone, drink 1 cup of warm water. Not cold, warm. Your colon has a reflex called the gastrocolic reflex, a natural wave of motility that the stomach triggers in the colon when it receives something warm first thing in the morning. Think of it as a wake-up call for your peristalsis engine, a gentle biological nudge that says the day has begun and the system needs to move. After 60, this reflex becomes quieter and less reliable. Warm water on an empty stomach is one of the simplest and most evidence-consistent ways to reactivate it, at 0 cost, starting tomorrow. Step 3, the position reset. This is the step that addresses the exit door. Place a small step stool, or even a stack of thick books, under your feet while sitting on the toilet, enough to raise your knees above the level of your hips. This position changes the anorectal angle, the geometry between your rectum and the anal canal, in a natural squatting position. The pubortalis muscle relaxes fully and the exit door opens at the correct angle. In a standard seated position on a modern toilet, that angle is partially closed, requiring more straining and more effort. This is not alternative medicine. It is basic anatomy, and for adults with pelvic floor dyssynergia, it is often the single most impactful change in the entire protocol, because it works with your body's natural geometry rather than against it. No cost, available tomorrow morning. Step 4, the 10-minute walk rule. Within 30 minutes of finishing any meal, take a 10-minute walk. Around the block, down the hallway, in the garden. Movement is not optional decoration here. It is a direct mechanical trigger. Physical movement stimulates the high-amplitude propagating contractions in your colon, the powerful waves that create the urge to go. These contractions are most responsive to movement in the post-meal window, when gastric activity is already elevated. A 10-minute walk after breakfast, lunch, or dinner is one of the most consistent and cost-free ways to reactivate a slow peristalsis engine. It does not need to be fast. It does not need to be far. It just needs to happen consistently. Step 5, the medication audit question. At your next doctor's visit, or your next phone call with your physician or pharmacist, ask this one question. Could any of my current medications be contributing to my constipation? And is there an alternative that would be gentler on my gut? Harvard Health Publishing specifically identifies this as one of the most impactful and most overlooked interventions for constipation in older adults. The answer may be no, but it may also open a conversation that changes everything, because medication-driven constipation cannot be resolved by fiber alone. Who should modify or avoid this protocol? If you have heart failure or advanced kidney disease, please speak with your physician before significantly increasing fluid intake or starting psyllium, as both can affect volume and electrolyte balance in ways that require individual monitoring. If you have liver cirrhosis, constipation management needs to be coordinated with your hepatology team, as changes in bowel function can affect ammonia metabolism. If you have had recent abdominal or pelvic surgery in the last 6 weeks, check with your surgeon before starting high-bulk fiber or changing toileting position significantly. If you are on chemotherapy, please discuss any dietary change with your oncology team before starting, as constipation in that context can sometimes signal obstruction rather than simple motility issues. So here is what I want you to do tonight. Go to your kitchen and check whether you have psyllium husk. If you do, put it on the counter where you will see it this evening. If you do not, add it to your next grocery run. Generic store brand under $3. Tonight before bed, 1 teaspoon in a full glass of water, that is day 1. Tomorrow morning, the moment you wake up, before anything else, 1 cup of warm water, then breakfast, then a 10-minute walk, and when you use the bathroom, feet up on something. Even a thick book under each foot is enough to start. That is the full protocol, in place by tomorrow morning. Now, before we finish, I want to be clear about when this video is not enough. If you notice any of the following, please stop self-managing and seek in-person medical care promptly. Blood in your stool, whether bright red, dark maroon, or black and tarry. This requires immediate evaluation and is never something to wait on. Unexplained weight loss alongside constipation, even a few pounds over a few weeks without trying. This combination needs to be assessed by a physician. Severe or rapidly worsening abdominal pain, especially with distension or the inability to pass gas. These can signal obstruction and require urgent attention. Nausea and vomiting alongside inability to have a bowel movement. This is a classic sign of bowel obstruction and is a medical emergency. Pencil-thin stools that persist for more than 2 weeks. This change in stool shape needs clinical evaluation. A new change in bowel habits lasting longer than 4 weeks, particularly if it alternates between constipation and diarrhea. This warrants a conversation with your doctor. Fever alongside abdominal pain and constipation. This combination suggests possible infection or inflammatory process that needs medical attention. Everything in this video is drawn from peer-reviewed research published in Harvard Health, the Canadian Family Physician Journal, Mayo Clinic Clinical Guidance, and a 2022 meta-analysis of 16 randomized controlled trials. All source links are in the description below. This is educational information. It is not personal medical advice, and your specific situation deserves a real conversation with your physician. If this video gave you something lasting today, share it with someone you love who has been quietly living with this, who has tried the basics and been left wondering why it has not been enough. Not for this channel, for them. That is not a bathroom habit, that is your independence back. We will see you in the next one.